We're going to turn next to swine flu, which is now officially in 11 states. 7 other states report additional unconfirmed cases. As the virus spreads, so too does the decision to close schools. 250,000 students are being kept home, more than half of them in the state of Texas. Ryan Owens is tonight in the biggest district to close, Fort Worth.
The school bells rang this morning across Fort Worth, but there were no students to hear them. All 140 of the city's public schools are closed for a week, all because one student out of 80,000 students in this district has swine flu.
Working parents in Fort Worth, they are scrambling.
Parents did their best to find childcare. Those who couldn't had to call in sick. Many here are hourly workers who do not get paid sick days.
We're asking for flexibility, and I'm sure that our business community can come up with some very creative ideas, rotating shifts, without creating undue hardship on families financially.
Still, most parents seem to support the district's decision.
I'm kind of glad that they're taking precautions and being careful.
We have to do what we have to do to keep the kids safe.
But was it really necessary to shut down an entire school district based on a single case? Just down the road in Dallas, they had one case today. Officials there decided to close just one school.
It's too soon to tell what's the best approach, but we will be looking at what people are doing, learning from it as it goes forward.
And today, more closings across the country. From Seattle,
this message is to let you know that school is canceled today.
To Nashville, students found the school door locked. And while they may be fun for the kids, these closings are intended to keep them away from each other. In Fort Worth, these mothers organized a baseball game.
I think everyone woke up this morning kind of, looking at like, what are we going to do?
Unfortunately, this is exactly the sort of close contact health officials hoped that canceling school would prevent. Ryan Owens, ABC News, Fort Worth, Texas.
And our medical editor, Dr. Tim Johnson, is joining us now. Tim, I gather scientists have had a chance to look at the genetic makeup of this flu virus, and I wonder what it tells them.
In an amazing feat of science, modern science, Charlie, they've been able to send out this sequence for scientists to study, and they found a couple of interesting things. One, there's an amino acid that's missing in this virus that is found in more lethal viruses, suggesting that this may not be, at least in its current form, as lethal as some had feared. There's also a suggestion that it's enough like past flu viruses, particularly the 1957 virus, that it may have produced immunity over the years, especially in older people, which may, and I stress the word may, explain why older people do not seem to be getting it yet.
But it sounds, if I read your answer correctly, as somebody who doesn't have a medical background, that you're saying they're finding this is not necessarily a terribly virulent or dangerous flu?
Well, they're saying it's much like the regular flu viruses of the past several years. That's dangerous enough, obviously, but that it may not be very virulent like some of the past pandemic viruses, particularly the 1918 virus. So it's a bit of good news. It could change overnight if there's a mutation, but right now I take it as some good news.
But then are we overreacting with that kind of school closures, etc., and all the concern that this is causing?
Public health officials are not overreacting. They're doing exactly what they should do. But to be honest, I think sometimes we as the media, we as public institutions, we as individuals do overreact. I think a school that closes without any identified case or risk is overreacting, and we're going to have to back off from that kind of action.
Well, then I want to play some remarks that the Vice President Biden made this morning. He was asked what he would tell a member of his family if that person was about to travel. Let's listen.
I would tell members of my family, and I have, I wouldn't go anywhere in confined places now. It's not that it's going to Mexico, it's you're in a confined aircraft. When one person sneezes, it goes all the way through the aircraft.
Is he overreacting?
Unfortunately, the Vice President sounded like he knew what he was talking about when he really didn't, but in an ironic way, the reaction, the information that has come out in reaction has been very informative, so I think it'll pass and we'll be all right.
All right, Tim Johnson, thanks very much.